Okay, so Dr. Alan Christianson is a board-certified naturopathic endocrinologist who focuses on thyroid care. He is a New York Times bestselling author whose recent titles include The Thyroid Reset Diet, which we'll cover today, and The Metabolism Reset Diet. Dr. Christianson has been featured on countless media appearances, including Dr. Oz, The Doctors, and The Today Show. He is the founding president behind the Endocrine Association of Naturopathic Physicians and the American College of Thyroidology. Dr. Allen's also here in Arizona with me. I'm like so happy about this weather. Are you loving it?
Oh, it's been awesome. Been really good here. Mornings are perfect.
It's like if I can be in flip-flops and a tank top, like I'm always happy about that. You know, I just so prefer it. Okay, so I'll be honest, when I first heard the premise of this book, probably like a lot of people, I was like, because I just didn't think that amounts of iodine could play like such a large role in your thyroid management. But after reading it, you know, you've clearly dug into the science like you always do. I guess one question I had is like, did you just sort of happen upon the science amongst your other research, or were you seeing things in your clients that had you suspicious that iodine was playing somehow kind of like a negative role in thyroid disease?
Yeah, there certainly was an evolution. You know, the first stage, I guess, when I started practice was having an understanding that iodine was important for thyroid hormones. It was essential, knowing that we needed some and knowing not much more than that. So that was like one stage. A few years later, there was a lot of popular approaches using megadose iodine. And I saw scores of people develop thyroid disease after attempting that. So I knew that was a bad idea. And that was like the next stage. And then there was more research coming out about the deeper understandings of how thyroid disease emerges and how central iodine is to that. And then studies started showing how, one could often reverse thyroid disease by closely regulating iodine. So that's kind of the last stage. And that's rather recent. That research itself was newer to all of us.
Oh, interesting. So yeah, one exciting thing I'll kind of give a teaser here is that you said regulating iodine intake could cause reversal of symptoms in up to 80% of people in as little as 3 months. So that's pretty impressive, right?
You know, so that particular study, their number was, they took people that had pretty severe thyroid disease. Your audience might know this, but you know, TSH is a backward marker. The higher it is, the more someone's thyroid is underactive. And above 4.5, it's considered abnormal. Many think that 2 is probably an upper limit for healthy people. Anyway, these folks, they had average TSH scores of 14, and many had them in the 50 to 200 range. They had pretty severe disease, and they'd had it for 4 years or more. And they did just one thing. They had them regulate their iodine, as we'll talk about. And within 3 months, 78.3% had perfectly normal thyroid function. Of those who didn't, a large number did not successfully regulate their iodine. You know, they weren't instructed well, or, you know, sometimes people aren't compliant, whatever. They didn't do it and it didn't work, you know. Others, they did do things well and they didn't get normal, but they got a whole lot better. So they went from like 200 down to 20. And with more time, they could have improved further. Only about 3% of people did successfully lower iodine, but failed to improve at all. So the rate of efficacy was just staggering.
So that 80% or nearly 80% was based on TSH or symptoms, or both?
It was based on TSH scores as far as.
Okay. Yeah, I did. I made a note of that study because I thought that was interesting. And that one was on, well, I don't know if this is a different study, but it was one that was specifically about Hashimoto's, it looked like. Yep. Was that the same study? Okay. So I thought that was interesting. I did want to ask you more about that because as we learn about autoimmunity, it has these different components, right? Gut health and mold. I definitely see mold in Hashimoto's all the time. So I was like, how did they reverse it so much just with iodine? Do you find that still, I don't know if you have an answer to this, like still for optimal health, you have to address other things? I mean, obviously TSH isn't the only marker of health. So maybe you can just explain more like how this one thing, iodine, is playing such a powerful role even in autoimmunity.
So TSH is a quick point on that. It's not a perfect marker. It's not everything. However, when it's 14, there's a problem.
Yeah, for
So
sure. I've
they
seen that
went
very
from
often.
14 back down to 3 or under. So there was a big shift there. And the big problem with TSH is really for those who are high normal and they ignore that there's a problem. That's the issue. But when it's way out of range, no one debates about that being a real thing. So yeah, that it was valid in that context.
Sure.
And yeah, funny thing, one researcher said that he summarized the last few years of research saying that iodine is not the only factor that's relevant to thyroid function. But in his words, to quote him, he said, but it's more important than all the other factors combined. It affects a lot. And
Yeah.
people do a lot of things that are generally healthy and can improve. And what happens is, in many ways, that people go on less processed foods or cut out common food categories that they do with autoimmune protocols. They often cut out a lot of iodine, even if they're not intending to.
Yeah, I was thinking about that as I looked at the list of, high iodine foods. So we'll definitely talk more about that. Like, I would say a health conscious person, more than an average American, is probably having lower iodine. Although, I still eat gluten-free products sometimes, and I'm learning those are high in iodine, like really high.
Okay.
And I'm like, so, even though I don't eat those every day, I eat them, and that could cause what really looks like a spike that my body is not appreciating. And that those, even if it's like 3 times a week, that could add up. I love that you have some simple solutions, like just, making your own products at home rather than store-bought baked goods. I don't know if we should skip ahead to the foods part. And so, well, maybe we should back up a bit and say most of my audience knows iodine is important for the thyroid, but maybe you can just talk about how it works exactly and why it needs to be so tightly regulated according to your research.
Yeah. So it's a super potent molecule. I mean, iodide is. It's 53 in the atomic scale, and there's no elements used in human nutrition that are close to that active in terms of the electron density.
Hmm.
So the body holds it very gently, very carefully because it's dangerous. So think about like bleach or hydrogen peroxide. So iodine is like those things. It's a very high source of free radicals. And all nutrients in the body, the chemical form in which they enter your system is the chemical form in which they're used by your body. And they float around your bloodstream. However much is there is enough for your organs and tissues, assuming that you're not deficient. And they've got a lot of jobs all over the place. Well, none of those statements are true about iodine. Not one of them are true. So you have to chemically convert it. You need to concentrate it. We only know of one essential role for it and only one organ in which it's critical. We convert it by oxidizing iodide into iodine. And that's the hot potato. That's the stuff that's like super dangerous and volatile. Now, when we have amounts within a healthy window, it's all good. That iodine, once it's made, it sticks onto a protein called thyroglobulin. And that's one of the first key steps in forming thyroid hormones. However, when there's a little bit too much, a couple things happen. The first one is like the least intuitive. So you would think that if you need this thing to make the hormone, that more of that thing would make more of that hormone. And if there was no safety mechanism, that would be true. However, if it were directly paired to iodine in, thyroid hormone out, if they were like directly linked, we could have our heart give out whenever we had
Wow.
a bite of seafood, because that
Mm.
little extra amount would just surge thyroid hormone, and that could be fatal. So we've got backup mechanisms. There's a fuse, so to speak. So extra iodine, for one thing, it slows the thyroid. It causes it to make less hormone. And if it persists, it then builds up inside the thyroid. And those free radicals, they damage the cells of the gland. They cause the immune system to get brought in, and they make the normal proteins of the thyroid appear to be foreign. So thyroglobulin being the main one, we call that antigenicity. It looks like it's a foreign substance. And then
Mm.
the enzyme that activates iodine and converts it is called thyroid peroxidase. So your immune system is all amped up. You've got all this stuff being damaged, and it goes after thyroglobulin and thyroid peroxidase. And that's the real onset of most thyroid disease.
Okay. Yeah, that's helpful. Um, So I have a question for you about labs. Like we tried that study where TSH was at 14. When I see just a TSH be high-ish, like 4 or 5, with the absence of much else going on in the markers, sometimes I often think, well, that might be just stress and the body's working the thyroid harder. But now I'm wondering, is that just could be enough that something's off with the iodine? Do you think that's possible?
That's the most common driver of thyroid disease. So the other
Okay.
conclusion is that there's 3 irrefutable causes, and 2 of which are called existential because we cannot change them, and that's age and gender. So the one real irrefutable driver that's not existential is the iodine status. And funny thing about thyroid labs, so you've got the TSH and you've got the T3, T4, total or free, either way will work in this context. And the TSH is the first thing to move. So it's the earliest indicator of there being a change in overall thyroid status. The T3 and T4, they will reflect the change when you're at the most extreme state. But before
Oh,
you are, the body buffers them. So if you're getting a little low, like say that TSH is creeping up to 4 or 5, the free hormones might be normal. You might even see them on the high side of the range. They could be most anywhere. And what's happening is your body is doing a lot of other tricks to not get rid of the hormone, to hold on to it longer, to keep more of it in active states, to delay its breakdown. So those don't show at first. Those only show when the
mm.
body can no longer try to keep up. Like you see a duck swimming upstream, you don't know how hard it's paddling, right? So
Right.
that's the T3 and T4. They're there, but you don't know how hard you're working to keep them there.
Well, I'm definitely going to start my clients on this kind of check of their iodine consumption now that, again, I saw that and I thought, well, your body's asking your thyroid to work harder. Could be kind of a stress pattern, but now it could be an iodine pattern as well. Before we get into the foods, I have a little historical question I want to ask you. You talked about this historical low iodine and how we started putting it in the foods. But even before that, I can think of like our primitive ancestors before industrialization. Did they just get like such a little sampling of natural foods that you think that that's how they kind of stayed in that um, ideal range of iodine? What do you think?
Well, so generally, and we think that there was 2 main types of human experience relative to iodine, and then some genetic variation because of that. So one was the groups that were primarily coastal, and in those contexts, they had a lot. They would get a fair amount from shellfish, from fish. They might have well consumed sea vegetables frequently, and so the mechanisms that they had that adapted, that epigenetically drifted within and between generations allowed them to do a good job excreting extra iodine. And so they didn't need to work as hard to pull it all in. They got better at getting rid of the extra. Now, the other genetic variation was those who were more inland. And some areas in inland, most have adequate iodine in the soil. So even if you're not consuming things from the ocean, the things that you plant and grow and the animals that eat that still get a lot from just raining down. But there's some areas where that's not true. Some areas that are far inland, that are in mountainous regions, that are surrounded by a lot of fresh water. And in those areas, the adaptive mechanisms were those that did a really good job just scouring every little speck and then holding onto it.
Mm.
However, those mechanisms suck when they're faced with an iodine excess. They're the ones that can't deal with those occasional excesses. So there have been pockets of humans that have been found, some through ruins and some through historical observation in the early part of the last century, that had a high rate of what's called Cretanism. So the people looked almost like Neanderthals. They didn't have the same physical appearance. And if you're
Mm.
severely low in iodine, there's growth stunting, there's poor cognitive development, and it leads
Wow.
to a state called cretinism, which honestly, it looks, you could spot it. If there were like 1,000 people and there was one cretin, you would spot it. It's like quite obvious. So yeah, there
Mm.
were pockets in which they did not get enough. And then even the coastal areas, even with their adaptations to deal with excess, they still had higher rates of thyroid disease. And we see that in areas like Japan today still.
Oh, interesting. Yeah, I think that's one sort of myth you busted with Carrie Jones, because there was, I mean, when I was earlier in my practice, I was definitely hearing like the benefits of iodine and for like breast health, and they're out of Japan is some of that information, but you're kind of saying, oh, that could be from other factors besides how much iodine they consume. Do you want to share any more on that?
Yeah, sure. That's been a real deep-seated one that comes up a lot. And that came about from the idea of iodine helping the symptoms of fibrocystic breast disease. That's kind of what spawned that theory. And then people started thinking, oh, wow, maybe really for breast tissue, you need these massive amounts of iodine. So had some studies in which they gave high doses of iodine and they lowered the pain of fibrocystic breast disease for 60% of women. It was helpful for many. But then some made the mistake to think that therefore that was filling a nutritional need. Nutrients can do things that are not related to their role as nutrients.
Yeah,
Iodine, it could help infections, but those infections, like I cut my skin, that wasn't an iodine deficiency. That was a thorn and that was some bacteria.
true.
So
Okay.
what we now know is that breast tissue has a continuum of how it takes in iodine. And non-lactating healthy breast tissue doesn't take in much. Lactating breast tissue takes in some. It's got that same kind of pump the thyroid has, but to a smaller amount. And then fibrocystic breast disease takes in extra, like far too much. And that extra uptake creates free radical damage and also creates more
Oh,
fluid uptake because it's a sodium based pump, and so more tissue swelling. And then the end of that continuum is breast cancer. That's where there's the most aggressive iodine uptake. So it's a crazy paradox. People thought that, yeah, if there's this thing where iodine might help fibrocystic breast disease, perhaps Japanese women eat a lot of iodine, they do have lower breast cancer. People put all that together. And then as the data got deeper, we now know that of the Japanese women, those who have the highest iodine levels are the ones who are developing breast cancer. And that's shown up in other populations as well.
it's amazing how these kind of misunderstandings and misinterpretations can get so far down the road, right? Like we've seen it in different examples. Because
Well,
go ahead.
well, the body is this totally complex self-regulating system. And you can understand and we always want to have simple principles. Like back when we
Yeah.
said, oh, there's cholesterol in plaque, therefore don't eat eggs. There's so
Yeah.
we want the simple principle. Cholesterol is a bad guy, therefore eggs are bad. Like, well, now we know there's layers and nuance where that's just not true at all. And so much of that is true in many aspects of the body that deeper understandings reverse the things that seem to make intuitive sense.
Yeah. It's so interesting. And it is those theories can last for a long time. Like I still have to tell friends about cholesterol and how it works. And they're like, I don't know about that. So, and now I'm going to have this conversation about iodine. So I want to talk about the foods, but I'll just take a break for a second to say, it's a great book. It's very accessible. I like books that are a little shorter on the explanation, a little longer on the plan. I just interviewed Siobhan about this book. It's similar, I'm like, thank you for not making me read 300 pages to just.
You should thank my editor for that. It would have been the
Oh, no.
opposite if it weren't for her input.
Well, good job, editor. Yeah, I mean, I know that I think that people when they're doing their research, they're like, look at all this interesting stuff. But we're like, okay, let's just get to the punchline.
I get no credit for that.
So I'll just stop to say, I really recommend the book if you have a thyroid condition, if you suspect you have a thyroid condition, if you're a practitioner. I think it's really important information. And I feel like it's fairly simple to learn and implement and just, recommend to clients, recommend the book. So it's really, really nice. The thyroid can be really complicated, but this issue is fairly straightforward. So
I can tell you how to use it in 20 seconds. So foods are green, yellow, red light. When you want to fix your thyroid, eat green light foods. When it's stable and you want to keep it there, still eat those, but you can add in up to 2 yellow light foods per day. That's the whole complexity of it.
yeah, so that's here. I don't know if we have I don't have a picture of that green, yellow, red in here, but it kind of in the middle of the book, you start going into which foods contain iodine. And I'll just give this little short list and then we can kind of riff off of it. So baked goods, dairy products, eggs, salt, seafood, and sea vegetables are food sources. And then other sources, cosmetics, vaginal douches, medications, and dietary supplements. So right at the top, baked goods, really high, much higher than you recommend for maintenance or repair, about three times often the amount. I don't know if people can see this. And you said, because I checked quickly, gluten-free is the same as gluten when it comes to iodine in food, unfortunately. So you said The best course of action to protect your thyroid, therefore, is to avoid all commercially baked products, which to some people, they might be gasping a bit. Do you want to talk more about that?
For sure. So we've had a couple stages of thyroid disease. I love your question about the history of that and the whole thing about cretinism. That's not really come up before as much. That's a fun thing to think about. Things were pretty stable for quite a while. And then we did have many areas that had goiter, that had thyroid swelling. And we started fortifying our salt with iodine. And the goiter rate went down, but the autoimmune thyroid disease went up 26-fold in America after we fortified our salt with iodine.
Wow.
So now this is about 1924 to about 1980. Things are about at a status quo level. Somewhere around mid 80s, very early 90s, thyroid disease started going up. And for about three decades running now, we've got 3 times the rate of thyroid cancers. And we've got about 3 times the amount of thyroid treatment taking place. The disease has basically tripled. And that's corresponded with an uptick in iodine in the categories of really baked goods and dairy products. It's been in all these other categories that you mentioned, and they're all, the cumulative dose is what matters, but they didn't change as much. It was the amount in processed baked goods and the amount contaminated in dairy that went up radically over that time frame.
Okay. Well, and so how about the salt itself, like the iodized salt? Because I figure that's probably in things like canned soups or like, I don't know, processed dinners or whatever. Is that not as radical of a source as baked goods then?
Well, so yeah, most salt used in processing is non-iodized.
Oh, well, that's
There's
good at least.
a weird exception. There's like Burger King. There's a few odd exceptions here and there, but by and large, it's non-iodized. So most salt for home use is iodized. And then the popular one now, the pink Himalayan salt, this is bizarre, but it has twice the iodine content that iodized salt does. So that can be, if that's your main salt source, yeah.
That's what I have going.
Well, so
Oh, no. Okay. So wait,
there's
I thought you said Celtic was okay. That's different than pink?
It is, yeah. So and
Oh,
so Celtic is a brand, and they've got a lot of different products in their line. And they make a light gray sea salt. There's a fine ground and a coarse ground. That's the one product line of theirs that's consistently low in iodine. So that's a great one if you like sea salt. But a lot of data has converged around this range of 50 to about 200 micrograms as being a pretty safe range. And yeah, if your main day salt intake is pink Himalayan salt, that's almost 600 micrograms of iodine from that.
so the coarse Celtic salt or the fine you said is
The
better?
light gray, so Celtic brand, and they're light
Light
gray, and then
Okay.
both the coarse and the fine ground.
Do you think that's why when you eat a salty meal, you feel kind of your heart's racing, or is that a different issue why you get like that?
Probably something different.
Okay.
Most things that do affect thyroid levels, thyroid hormones are running on like 4 to 6 week averages in the blood. So if something changes really fast, we'd think about probably other causes, blood
Okay.
sugar, fluid,
Okay.
whatever else.
I just was going to show this chart. So yeah, and thank you for bringing that back. So there was an issue with low iodine for a while, and then we started iodizing throughout the world, really, and then it was just starting in the like 90s, 2000s, and then you can see that huge increase in, let's see what you're.
Thyroid cancer for that one.
Oh, okay. Yeah, so that's crazy. It's such a simple thing to adjust. Do you feel like there's a conversation on it in a national or global level, or no?
In terms of the issues of excess, it's emerging, and there's more research taking place about that. But I
Okay.
don't know. There's really no one who that falls under their domain of authority to address or do things about. Not fault the conventional world, but its main focus really is management of thyroid cancer or management by medication. They're not as focused on lifestyle. It's not their thing as much. And those who do focus on lifestyle, that's kind of why I'm happy to be here with you, because I want people like yourself and your audience to be aware of this so we can help educate others. This is how it's going to be championed.
Right, yeah. So you said in baked goods, iodine is coming from iodized dough conditioners. And then with dairy products, you said it's mostly come from iodine to sanitize cow teats, which is great to think about. It's amazing that you get so much into you from cow teats. Is it just like it's really absorbent in that tissue?
It is, but also it's just so concentrated. So this is a microgram thing. So if you've got
Gotcha.
if you swab some on and you absorb like 4% of it, that can be just a massive amount still. Like with cosmetics, I did the math on that, and a tiny amount coming across the skin can be 2,000 micrograms. I mean, microgram is not a big thing. So it's just that
2000. Wow.
it's just that it's so concentrated and powerful.
Okay, so maybe before we talk about more food sources, this is a chart. I don't even know if people can see this, but it's a little bit about red, yellow, and green and how many micrograms to get a day, whether you're maintaining or resetting or have a goiter. So most people aren't having a goiter. Most people are, trying to maintain or reset. So you said the maintenance phase is 100 to 199 micrograms a day. So if you're getting a little from lotion, or you're getting 600 micrograms from a gluten-free bagel or whatever, you're getting quite a bit more. And I think you said that you can store it for about 3 months. So it's going to take about minimum 3 months to clear that excess. Is that right?
Well, and that's the thing. The thyroid doesn't really have a lot of ways to get rid of the extra. It basically, iodine leaves the thyroid in thyroid hormone. So if the thyroid's sluggish, it's not making much. If someone's on medication, it's not making a lot. And it can't make extra anyway. It can't just like dump out 5 days worth of hormone at once, because that's not safe for your body. So when it's got too much, it can, and the thing too is that it can only get rid of that trickle amount if the daily amount coming in allows that. If the amount that's coming in day after day is already
It's
everything you
high.
need, you can't get rid of
Right.
anything. It's only
Gotcha.
when you can create that deficit that you have the room then to trickle some out over time.
Okay. So when I think about my own clients, this is a kind of a fun segue. They may be having a few baked goods. They probably aren't having dairy, because most of my clients don't have dairy, but they're having non-dairy things, which contain some carrageenan that you mentioned. And we had Mira Desi on in December, and she was saying how carrageenan can be a gut irritant. But it sounds like it has iodine. Is that correct?
It can, and I think that
Okay.
a lot of folks like you all have done a good job educating people, and the manufacturers have responded. I don't see it show up as much in the dairy substitutes as we used to a few years ago. So you still might catch it now and then, but thankfully there's a lot more non-dairy options that are free of carrageenan.
Okay, but that is like a seaweed, and it does contain iodine?
Correct.
Okay, good to know. Okay. Yeah, and she brought up a great point that was, I think, great awareness for our audience too, is that when you're stacking the day with tons of non-dairy creamer and milk and stuff, you're getting a lot of carrageenan potentially. Like you said, maybe it's coming. You're right. I think it is coming out of things, but you're still getting like other additives that can be contributing to IBS and that kind of a thing. Oh, I was like, do you need to leave?
No, I just
Are we
brought in
good
a
on
little
time?
more light.
Okay. So a few more categories that might be interesting to people. We talked a bit about salt. You said egg yolks are a natural source of iodine, correct?
They're nutritionally dense, they're good foods. There's a few things that I wish weren't on the list, and that's one of the top ones, but the thought though is that there are things to avoid during that reset phase, but during the maintenance phase, people are welcome to add them back in within the constructs.
Okay, but maybe not. I mean, I have some friends, like I have some friends in Portland who have chickens, and they're like, we sometimes eat in our family 12 eggs a day. I'm like, that's a lot of eggs. Do you think that could be too many well, they're not all having 12 eggs, but they're maybe each having 4 eggs a day. Is that potentially too many?
It could be. I have a lot of people ask about their own chickens, if they would still have iodine in there, if they only feed them things they're aware of. And some have assayed. I've had given people sources by which they can actually assay products to see iodine content, and sometimes they're lower. But yeah, when it's that window of repair, my thought process is, let's just be sure. Let's just not do anything that might be borderline, so you can have a good chance at getting better.
Right, especially in that restoration phase. And one of my friends in that family has a thyroid issue. I think she's even on medication. So I saw one thing you mentioned in the book is like, don't just go off your medication
Yeah.
um, while you're on the diet, or even maybe not after, because there's been damage to the gland, and that's something to be kind of managed with your physician,
Yeah.
correct?
Yeah, so a couple of thoughts. Those on medication, it's pretty common that they end up responding better to the medicine and oftentimes needing less. So
Okay.
iodine, I mentioned how it makes your thyroid not put out as much, but also it makes your body not respond as well to what the thyroid does put out or what the medications contain. So as your response clears up and improves, people often notice that the same medicine that didn't seem to help their symptoms, now their symptoms do better. So that's, even those that don't have a thyroid, they can stand to win that way. But yeah, those on medication, they also want to be alert about the fact that they may need less and they may need adjustments because of this change.
Well, one thing I read that you said is like a control is not only maybe you make less thyroid hormone when you have too much iodine, but that you become less responsive to thyroid hormone, you said. So that could be a reason. That's been a reason I've really struggled with over time. I'm like, we can run all these tests, but we don't know how responsive your cells are to thyroid hormone. So that's been a frustration of mine.
Well, and that kind of goes back to what I was saying about how T3 and T4 don't show you how hard the body works to keep them there. We think about how we control the thyroid from above, the pituitary and the hypothalamus, and then we think about all the ways in which we control the hormones from below. Your cells, your tissue, your liver, your kidneys. There's your intestinal tract. There's countless ways by which we change how these hormones are converted, how they're bound up, how they cross the cell membranes, how they interact with the mitochondria. And many of those things are blocked by too much iodine. So as
Mm.
it comes to a better range, your body can be less resistant and respond better to thyroid hormone from wherever they're coming.
Yeah, I was just reviewing something about how mitochondria respond to thyroid hormone, and I think I had kind of missed that. And I was like, what? That's really interesting because mitochondria damage big in the toxin space, so
Yeah.
that's kind of a focus of ours. So, yeah, it's also intertwined. And I'm honestly just really thankful for this book because it's such a simple thing that I can give clients to do to just sort of, okay, let's remove one thing that could be causing a problem here. It really is fairly simple. I do recommend getting the book because there's things to learn about like cosmetic ingredients and
That one really shocked me too. I was just reading more about that today. There's a lot of iodine ingredients that have been banned in Europe that are not restricted just yet in the United States. It was 2016, we did pull them out of hand sanitizers because of
mm,
higher rates of thyroid disease in hospital workers that were using them and high iodine levels in their bodies. But the same things go on in cosmetics. I think it's most relevant for things that we apply to our skin and we have a chance to absorb conditioners, face lotions, skin creams, face
okay.
masks. Something that I didn't put in the book that I just read about today, many of the common colors in lipsticks, FD&C number 5,
Mm.
erythrocene, are dense in iodine. And we actually eat, so to speak, about 40 milligrams per application of lipstick. And if you run the math on all that, you can end up with about 300 micrograms of iodine from that 40 milligrams of lipstick that we absorb. So there's a lot of sources like that.
Oh, really interesting. Yeah, I'm going to take this list, and a company I advocate is Beauty Counter, and they've banned 1,600 ingredients. But I will be curious to see have they banned these ones or not. They may be aware of it, but I'm not totally sure. I just want to ask you one more question, then we'll take this one on the thing, and then we'll head off. I didn't see this in the book, but I might have missed it. I think there is like such a thing as iodine testing, like that people do. Yeah, here's probably a reason you didn't talk about it.
No,
Your
I
stance?
did mention it.
Okay, maybe I didn't find it. Okay, yeah, tell us like, should we bother or should we just like, what
Well,
what should we
so
do?
it's not accurate and it's rarely helpful. So
Okay,
it's
so no.
it's it's almost always accurate in the context of a population. So if you've got like 500 people, you can get urinary iodine levels. That's the easiest, most cost effective, and you can gauge the population status. But you can't extrapolate that well to individuals unless you check individuals about 300 to 400 times repeatedly. So there's
Mm,
iodine blood tests. They're not useful for other reasons. They only show up the toxicology range. They don't really correspond to the nutritional range of iodine changes. Skin tests for iodine, not useful. I can talk
okay.
more, but they're just not accurate. And then the question is, does do iodine tests predict response to iodine regulation? And some of the studies I looked at who showed that people could successfully improve their thyroid function, there's one way that can be somewhat accurate. I'll talk about that. But when that was done, it didn't predict who got better and who didn't. So what we now know is that the thyroid has its own compartment of iodine that's not always reflective of external tests. However, if someone does do the thyroid reset and they're 3 months in and their symptoms and their thyroid levels are not budging, then that can be worth testing. And there's a test called the urinary iodine to creatinine ratio.
Mm,
That's done by LabCorp and by ZRT Labs. And that one helps to calibrate iodine based upon how much protein the kidneys are excreting at that point in time. So it takes out some of the random fluctuations. And it doesn't perfectly show someone's status, but it does show whether they're eliminating iodine or staying steady or gaining on it. And the numbers
Okay.
there are just 50 and 200. If they're below 50, they're eliminating. If they're above 200, they're gaining. So, but again, the time that's useful is if someone is 3 months into it and not making headway. And so
Okay.
if their
So,
iodine levels are low at that good range, then they may not respond. It may not be helpful for them. If they're not low, one of two things is happening, and that's really common. They've just not yet finished their detox. They just need more time. They had more
okay.
that was there, or there are some sources they've not yet identified, some ongoing sources of iodine coming in.
Okay. Yeah, and you give different information about testing and what different thyroid conditions. So I think it'll answer a lot of people's questions in the book. Marie asked a good question: that does natural desiccated thyroid medication have too much iodine?
So there is iodine in all thyroid meds because it's part of the active hormone. And it does happen to be a little higher in NDT than it is in the synthetics because the synthetics only have a hormone, where NDT has a pretty big spectrum of hormones and also hormone analogs. However, there's hormonal iodine and non-hormonal iodine. So if someone's taking thyroid medication and the amounts they're taking are anything but not too much, if they're if they're anywhere in the ballpark, then the iodine is really not relevant because it just reflects what the body would have made anyway from thyroid hormone. So if someone's taking too much thyroid medication, then there's a lot of problems with that. And the iodine is one of many problems. But yeah, if you're on too much, it counts, but you don't want to be on too much anyway. So
Mm.
yeah, we could talk about the math of what's in them, but really, when I think about someone's total day's iodine intake that we want to do things with, that's just not part of the equation.
Okay. Oh, that's really helpful. I love that I can throw like all these questions at you and you're like, "Yep, I got it. I got it." It's really
Maybe I'll get a new
fantastic.
one. That happens.
Yeah, I'll try to keep you on your toes for your next book. Yeah, I think it's just such a simple concept to implement. So I really want to recommend the book. I'm going to buy it for the coach who works for me and really just try to get it into. We test for people watching. We offer a full thyroid panel. I'm sure Alan does with his clinic as well. Because a lot of times the trouble is when you test, you don't really have the right person to help you interpret your test. So we are happy to, kind of facilitate you getting a test yourself so you don't have to go through someone who is questioning why you're doing any of this. And then we're definitely going to help incorporate some of these ideas. Alan, you've got practitioners who work online as well, right? Who do specialize in the
We've
thyroid.
got we have doctors in our clinic that
Yeah.
manage their thyroid disease. And
Yeah, and most importantly, I say, get the book. We're definitely proponents of being, your own best advocate. And I think that it's not like a plan you have to be nervous about or anything. Alan really walks you through it. So you don't necessarily, if you already know you have a thyroid condition, you've already kind of tested, it's just a great tool to use. And in 3 to 6 months, you're going to have an idea how it's working for you by symptoms going down or tests. Would you say, Ellen, you see if people are a little bit, maybe their TSH is only 3 or their free hormone is kind of borderline, you still seeing some improvements in labs from this diet?
well, again, so that early study, people were off by a huge amount. So subtle changes can respond quite readily.
Okay. Okay. Do you want to take this last question? It's a little
Yeah,
less common, but the use of iodine to treat radiation exposure. You think you did
sure.
talk about that in the book, yeah, or higher
I
need?
barely touched on that, but actually that kind of confirms this mechanism that I was talking about by which iodine shuts down the thyroid. So this is called the Wolff-Chaikoff effect. And basically extra iodine makes your thyroid not take up iodine. So that's why it's been used for radiation prophylaxis. If you know there's a window of time in which someone will be exposed to radioactive iodine, if before then they take a high dose of normal iodine, then that just stops their thyroid from absorbing iodine. And therefore, they won't take on the radioactive iodine and they won't have the risk for thyroid cancer decades down the road. So, back during the Fukushima disaster, for example, there was the NORAD brand of potassium iodide pills that were talked about a lot and very popular. The practicalities of iodine for that purpose are extremely narrow in terms of which age of people it helps. exactly how many hours before exposure it's useful. It's something that's not really practical for most adults. And it's really mostly for kids. And if they know they're going to be exposed in the next couple of days. But yeah, it works on that same mechanism. It just a high dose stops the thyroid from working. So if the body was flooded with radioactive iodine, it wouldn't get taken up by the thyroid.
Right, kind of one of those control mechanisms. So yeah, that was probably a condition you're going to be working very specifically with a practitioner if you're dealing with something like that. I've had one client who was exposed to really heavy radiation as a child, and her numbers were so crazy. Like, I don't know if that could come down, as you know, like you said, there's some people who need to stay on medication and that kind of a thing, because there's those special cases for sure. So, well, thank you so much, Dr. Allen. It was, or we could go by Dr. C. I don't know. I call you Dr. Allen.
Alan, it's all fine.
It's all the things.
We're friends.
Really great to have you on. I'm definitely going to promote the replay of this video. I think it's a great concept. And yeah, again, so simple. Just nice to have something be simple for our health. Not so complicated. Thanks for being on. Next week, you guys. Oh, let me mention a few more things. Alan's last book is presented on our DIY Detox Summit that starts Monday. So we talk about kind of DIY blood sugar management, metabolism management. So if you haven't signed up for that, do so. And then next week, we have 3 Facebook Lives. A little bit because of the summit will be live. So we've got one on kind of like EMF, one on biocidin products, and one on food sensitivity. So they'll be all next Friday, 3 in a row. So a little unusual for us. So keep an eye out in your email for that. All right. Thanks again, Ellen. Thanks, everybody.
Good to see you, Bridget. Fun to hang out. Bye-bye.
Bye.